When treating a patient with low back pain, some of the areas that we want to look at is the alignment of their sacroiliac joint, if they have any report of a lateral hip pain, or if they have any pain down the back of the legs reported as a sciatica type symptoms. These can all be coming from that sacroiliac area, even though their primary complaint might be low back pain. So our pelvis should change a little over time, and one side of our pelvis can lift higher or lower, and the opposite side can also. So if they get out of alignment where one side is staying elevated compared to the opposite side, that can be painful right in this spot right back here, and that's going to affect the base and the alignment of your spine, so that's why they come in reporting low back pain. So if we were looking at this, what we would do is we would look at the tops of our pelvic crests. So we take our hands nice and flat, we put them right on top there. And you can possibly do this either using a camera or looking into a mirror or having another person look at you. But say my left side was up a little bit higher than my right side. Well, that means that my pelvis is in this position, and that obviously is going to be uncomfortable and also affect not just my back, but also my knees, my ankles, even my neck, the whole system. So what we want to do is get them back into a leveled position. So a good way to do that is if my left side is elevated, I want to press my left side down and raise my right side up so that when they relax, they come back to a neutral position. So what we would do is lay on our back with our legs straight and our heels against the wall. We're using a box for video purposes, but laying down flat. And what I want to do is, because my left side is elevated, I want to push my left heel down into the box, and I'm going to pull my right hip up towards my armpit. So I'm making my left leg long and my right leg short, which is the exact opposite of the way I was presenting. I'm going to hold that for 5 seconds and relax. I'm going to do that 3 times. Then after we're done with that, when we get back up and we check, we should find that that pelvis is more level. That should also give us some relief of some of those symptoms that were in the back of the SI joint, the lateral hip, or down the back of the leg, and even relief in the low back. That's one of the common things that we see, and if we don't address that alignment, it doesn't matter how much tissue work or how many stretches or how many exercises we do, if their pelvis is always like this, we need to get them back to here. So if the left side is elevated, we press that left heel down, pull that right hip up, and then we relax. Now, ideally we do it in lying down because that's an unweighted position, but you could do it in standing also, where you can hold on to something for balance, and I can push my left heel down into the ground and hike my right hip up. So it would look like this, which is exactly what it looks like when I'm laying down, and holding that for 5 seconds, and then relaxing and doing that 3 times. So this would work if I was at work, if I was at the store, if I was doing an activity and I couldn't get laying down on the ground. Maybe I could do that to give me some relief, to get me through the activity until I can get home, lay down and do it the right way, laying on our backs.